What can you do? Well, you can just accept that you have an overactive bladder and manage it so you're not getting your clothes wet. That's what incontinence management is. You can address your underlying medical conditions like I spoke about, your diabetes, weight loss, things like that. Lifestyle changes. I'll go through what those are to help decrease how many times you're urinating. Prescription medication. This is usually where people will look up, because no one wants to do these things, right? We just want a medication that helps us sort of make things better. But there's also some hard work that we can do here on lifestyle and other things to do prior to medication. There are many medications we can try. I'll show you some. I'll tell you what I like. I'll tell you what I don't like. Bladder Botox. I love bladder Botox. Has anybody ever heard of this or had bladder Botox? Raise your hand. 1, 2, 3. So the same Botox that you think of for wrinkles is used on the inside of the bladder. I'll go over that. It can be very effective. Nerve stimulation, peripheral and central. I'll talk about why that helps. And then prostate surgery in the men who have a big prostate that is causing their bladder to be overactive. We can reduce the size of the prostate, let the urine come out easier, and reduce their urinary symptoms. Underlying medical conditions, diabetes management, weight loss, address your insomnia. The rep for this device recently came to our clinic, and I really enjoyed learning about this. This is instead of the CPAP machine. Many people do not want to address their sleep apnea because the CPAP machine is so annoying and loud and uncomfortable, and no one wants to do that. So you know what? I'm not even going to get a sleep study because I'm not going there. Well, there's another treatment option now. This is an implant that stimulates a certain nerve that keeps your airway open when you sleep to allow you to decrease snoring and decrease all of that stuff that comes along with sleep apnea. So there's other options. Smoking cessation. A big one that irritates your bladder. This is hard for people to do. It's hard. You know, if I tell you, hey, you can urinate less frequently if you stop smoking, some people will say, no thanks. And that's fine. That's fine. Manage constipation. A full rectum puts pressure on your bladder because they're right next to each other. So if your rectum's constantly full with hard stool, it can lead to bladder dysfunction and bladder symptoms. This is a picture of a little secret that I learned about getting pregnant and dealing with all those bad things like hemorrhoids and all the other stuff no one wants to talk about. I love this. I tell people to try this. Even though it's a laxative, I find it to be quite gentle. It's over the counter, and Colace and Senna, those other things, have never really worked for me. But if you're ever in a bind and you have significant constipation, try this out. So it's just something I discovered that I like quite a bit, actually. Incontinence management. Okay, so how am I going to prevent my clothes from being wet and me embarrassing myself in public because I'm leaking all the time? Pads, of course. Okay, that makes sense. There's pads for men too. Yes, there are. Diapers, big pad. Okay, like we're a baby again. Barrier creams, because the frequent urination on the inside of the legs and on the buttocks will become very irritating. So some older folks are brought in by their family members purely because of a rash in between their legs, and then we discover it's because they leak urine all day long. External catheters, meaning the catheter's not inside the bladder, but we're draining the urine on the outside. This weird thing is called a condom catheter. So this goes over the penis, it's secured over the penis, and then a catheter tubing is hooked up right here into a bag. This keeps the catheter out of the bladder, so this is more comfortable. And then under your pants, you can be dealing with your leakage like this and no one can see it. This is for women. This device right here goes in between the labia, and this is called a PureWick device. It's frequently used in the hospital a lot for incontinent women or women who can't move to urinate. Again, keeps the catheter out of the bladder. It'll suction or absorb all the urine and put it into this canister at your bedside. This really isn't of any use, like walking around and doing things. It's sort of more for older folks. This guy right here is called a urinal. You can order these on Amazon. I actually ordered this for my own father prior to him having a prostate procedure because he's retired and he loves to go on road trips. And he told me he was urinating in Coke bottles in his car because he would develop such an urge to urinate that he could not find a bathroom in time. And I'm telling you this because this is how common these types of things are. And his daughter is a urologist, and he really didn't even come to me with this. I think I saw the Coke bottles or something, and the next thing you know, I ordered him this on Amazon, and it has a lid. You could throw this in the back seat of your truck, you know, if you're in a sticky situation. So there are things that you can do. Pessary. A pessary is for women. It helps push up prolapse, but it also helps put pressure on the urethra. There are incontinence pessaries that can be inserted into the vagina and put pressure on the urethra and close the outlet so you don't leak urine as much. Lifestyle changes. Bladder training. What does that mean? This means, okay, if you notice that you leak urine, if you don't pee every 2 hours or 3 hours or 4 hours, because there's sort of trends, right? If your bladder is starting to become hyperactive at about 200-300 cc's, this will become obvious to you. So you can learn to urinate every 2 hours or every 3 hours to prevent those leakage episodes. Say you notice that at your desk, if you haven't gotten up to pee at hour 3, all of a sudden you will have an urge to urinate so bad at about 3 hours that then you can't make it. So then what you could do is say, okay, I'm going to empty my bladder every 2 hours to prevent that. That's what bladder training is, and timed voiding. That's what that means. A Kegel exercise. This helps strengthen the pelvic floor. You commonly will hear this for women after they've had a baby to strengthen the pelvic floor in decreasing continence, but men can do it also. How I describe a Kegel to folks is I say, imagine urinating in the toilet. You're sitting or you're standing. How are you going to cut your stream off midstream? What muscles are you going to contract? So do that right now sitting in your chair. It's hard to explain. It's not your abdomen, it's not your butt cheeks. Those are your pelvic floor muscles. And the squeeze you just did just now is a Kegel exercise. You can squeeze and hold for 5 seconds and do reps of those, or you can do rapid fire like this. Those types of maneuvers will strengthen your pelvic floor, but I'm not going to lie, this is going to help you very little, but it's something. Especially if you have an urge to urinate and you can do a Kegel right then, that'll suppress the urge and give you a little bit more time to make it to the bathroom. That does work. Fluid management. If you're having issues like we're talking about, you probably should cut back how much you're drinking. Look at what you are drinking. This is as long as you don't have any other issues that's requiring you to drink more fluid. But we're taught, drink. I need to drink tons of water. So some people will come in and on their bladder diary, they're drinking 5 liters of water and they're exercising all day. And guess what? They're urinating all day because your body doesn't need that much water. So try to cut back to 2 liters if you're having problems with this. And this is important. Fluids that you drink in general after 7 p.m. will cause you to wake up at night to urinate. So if you're having 2 or 3 glasses of wine every night at 8:30, you're going to wake up at night to pee. So I tell folks, which one bothers you more? Waking up at night to pee or not getting that wine? It's up to you. I mean, I'm happy for you to wake up at night to pee if you really want the wine or whatever. Something I've noticed for myself is I'm busy all day. I don't drink that much fluid all day. And then at night, I drink a lot of fluid because it's sort of like I'm catching up. And then I wake up, several times at night to pee. Limit food and drinks that irritate the bladder. Avoid bladder irritating foods, carbonated drinks, caffeine, acidic fruits, tomatoes, chocolate, food dyes, spicy food, dairy, sugary foods, everything. That's too much, right? That's too much. This is my hot list. Just remember these. Alcohol, sour, acidic foods. Tomatoes is a big one for some reason. Caffeine, spicy foods. The combination of caffeine plus carbonation is what I have found to be the most irritating for me personally. This is more irritating, an energy drink, than say a cup of coffee for my bladder. If I have too much of this in one day, I'll be uncomfortable all day and I'll be urinating like every 30 minutes or every hour because it annoys the heck out of my bladder. Whereas I can do a couple cups of coffee without that effect.